Autism spectrum disorder (ASD) is a complex developmental condition characterized by challenges with social skills, repetitive behaviors, and communication. It encompasses a wide range of symptoms and abilities, which is why it is referred to as a spectrum. Individuals with autism may have varying degrees of impairment and can display strengths in certain areas, such as attention to detail or advanced memory skills. Myths and misconceptions about autism. Before discussing remedies and interventions, it's essential to address some common myths about autism. Autism is a disease. Autism is not a disease but a neurodevelopmental condition. Individuals with autism lack empathy. Many individuals with autism feel empathy but may express or perceive it differently. There is a one-size-fits-all treatment, as autism manifests differently in each person. Interventions must be tailored to individual needs. Current interventions and remedies for autism. There is no known cure for autism, however, various interventions and remedies can help improve the quality of life and functionality for individuals on the spectrum. The best approach often combines multiple strategies tailored to the individual's needs. 1. Behavioral interventions. Applied behavior analysis (ABA) is one of the most widely used therapies for autism. It involves using techniques and principles to bring about meaningful and positive changes in behavior. ABA therapy can help improve social skills, communication, and learning abilities. Key points: focuses on reinforcement of desirable behaviors. Can be customized to fit the individual's needs. 2. Educational support. Specialized educational programs can significantly impact children with autism. These programs may include individualized education programs (IEPs), tailored plans that outline specific educational goals and the support needed to achieve them. Inclusive education, integrating children with autism into regular classrooms with appropriate supports can enhance social interaction and learning. Key points: education tailored to individual strengths and weaknesses. Early intervention is crucial for better outcomes. 3. Speech and language therapy. Many individuals with autism experience challenges with communication. Speech and language therapy can help improve verbal and nonverbal communication skills, facilitating better social interactions. Key points: focuses on enhancing communication abilities. Can include teaching alternative communication methods, such as sign language or picture exchange systems. 4. Occupational therapy. Occupational therapists assist individuals with autism in developing daily living skills and improving sensory processing. This therapy can help individuals learn how to navigate their environment more effectively. Key points: focuses on life skills and sensory integration. Can help with fine motor skills and coordination. 5. Social skills training. Social skills training helps individuals with autism learn how to interact with others more effectively. This can include role-playing, social stories, and direct instruction on social cues. Key points: enhances understanding of social norms. Provides practice in a supportive environment. 6. Medication. While there is no medication specifically for autism, some medications can help manage associated symptoms such as anxiety, depression, or attention issues. It's essential to consult with a healthcare professional to determine the best options. Key points: medication should be considered as part of a comprehensive treatment plan. Regular monitoring and adjustments may be necessary. 7. Dietary and nutritional approaches. Some families explore dietary changes, such as gluten-free or casein-free diets, hoping to alleviate symptoms. While some individuals report improvements, scientific evidence is limited. It's vital to consult with a healthcare provider before making significant dietary changes. Key points: individual responses to dietary changes vary. Consultation with a nutritionist is recommended. 8. Alternative therapies. Various alternative therapies, such as art therapy, music therapy, or animal-assisted therapy, can provide additional support and enrichment for individuals with autism. While these therapies may not replace traditional interventions, they can enhance overall well-being. Key points: can provide emotional expression and enjoyment. May improve social interaction skills. The importance of family support for individuals with autism extends beyond the individual. Families play a crucial role in the overall success of interventions. Family training and support can empower caregivers with strategies to assist their loved ones effectively. Key points: family involvement is key to successful outcomes. Support groups can provide resources and shared experiences. Conclusion: while there is no definitive best remedy for autism, a combination of tailored interventions can significantly enhance the quality of life for individuals on the spectrum. Understanding the unique needs of each person is crucial in determining the most effective strategies. Continuous research into autism and its management is essential for developing new and improved treatments, ensuring that individuals with autism can lead fulfilling and meaningful lives. Remember to consult with professionals in the field to create a comprehensive and personalized approach that best suits the individual's needs.